When evaluating specimen sources, it is essential to consider the normal flora, expected pathogens, and special testing notes. In the throat and oropharynx, normal flora include alpha streptococci, staphylococci, Neisseria species, and anaerobes. Pathogens include Group A Streptococcus, Corynebacterium diphtheria, Bordetella pertussis, and Haemophilus influenzae. Diphtheria creates pseudomembranes due to toxin production. Whooping cough is confirmed with fluorescent antibody testing, and acute epiglottitis in children should be diagnosed using blood culture rather than throat culture. For the eye, pathogens include Chlamydia and Neisseria gonorrhoeae in newborns. For the ear, Pseudomonas aeruginosa causes swimmer's ear, while Haemophilus influenzae and Streptococcus pneumonia are common causes of otitis media. In the lower respiratory tract, good sputum samples are crucial. They should be early morning specimens with fewer than 10 to 15 squamous epithelial cells per low-power field, since excess epithelial cells indicate contamination. Pathogens include H. influenzae, Staphylococcus aureus, Streptococcus pneumonia, Klebsiella pneumonia, Mycoplasma pneumonia, Mycobacterium tuberculosis, Legionella, and fungi. Transtracheal aspirates and lung tissue should be sterile. If pathogens are present, anaerobes are often involved. These specimens bypass oral contamination. Bronchial washings contain oral flora but are primarily used for mycology and acid-fast bacilli workups, rather than anaerobic cultures. Gastric specimens are important for detecting Helicobacter pylori, often confirmed with a rapid urease test. Finally, in the colon, normal flora is very profuse, but key pathogens include Shigella, Salmonella, Campylobacter jejuni, Yersinia enterocolytica, Vibrio cholerae, toxigenic E. coli, and Clostridium difficile. Diagnostic notes include using selective and differential media such as MAC, EMB, HE, and XLD, with GN broth subculture after 6 to 12 hours. Yersinia requires incubation on MAC at room temperature for 48 hours. Vibrio requires TCBS agar, and Clostridium difficile is best confirmed with an EIA test. Let's continue reviewing specimen sources and potential pathogens. For the urinary tract, it is normally sterile, although contamination from fecal flora may occur. The most common pathogen is E. coli, but other gram-negative rods, Enterococcus faecalis, and Staphylococcus species are also seen. A midstream clean-catch specimen is required, and more than 100,000 organisms per milliliter indicates infection. However, smaller numbers may still be significant if white cells are present. In the genital tract, several pathogens are important. Neisseria gonorrhoeae is diagnosed with a gram stain in males, but for females culture is required, typically on Thayer-Martin selective media. Chlamydia trachomatis is better diagnosed with serological or molecular tests. Group B Streptococcus is clinically important in pregnant women. Other agents include herpes simplex virus, Trichomonas vaginalis, a parasite seen on wet mount, Treponema pallidum detected with dark field microscopy, and Gardnerella vaginalis, which causes vaginosis and is identified by the presence of clue cells. Cerebrospinal fluid, CSF, is sterile under normal conditions. Important pathogens include Haemophilus influenzae in children under 5, Neisseria meningitidis, E. coli, and Group B Streptococcus in neonates, as well as Cryptococcus and Listeria in immunocompromised patients. For deep wounds and abscesses, both aerobes and anaerobes may be present depending on the site. To avoid contamination, a needle aspirate is preferred over swabs. Superficial wounds, such as pustules, dermatitis, or rashes, are often caused by Staphylococcus aureus, Group A Streptococcus, or Pseudomonas aeruginosa. Finally, blood is normally sterile. Any organism isolated from blood cultures is considered pathogenic, especially in immunocompromised patients or those with prosthetic heart devices.